Welcome to Section 2. In preparing for your practical assessment, we'll help you feel clear, calm, and ready for what to expect.
This assessment isn't trying to trip you up. It's checking whether you can carry out real workplace or community tasks safely, in the right order, while an assessor watches against the clear checklist. You'll do the practical workshop face-to-face. During training and practice, the checklist is there to guide you, but when it's time to demonstrate, you'll complete the task without it. And if you don't pass the first time, that's not the end of it. You'll have time to practice again, then resit when you feel ready to show the standard confidently. Each time, begin with the same primary assessment. Check for danger, check response, send for help, then assess airway and breathing. That steady sequence matters because when the situation changes, you don't have to guess. You follow the same calm order and keep your actions consistent under pressure. From there, your next move depends on breathing. If the casualty is unresponsive and not breathing normally, start CPR and use an AED as soon as it's available. If they are breathing normally, place them in the recovery position and keep monitoring. They're looking for you to read the scene safely, handle the casualty correctly, and choose the first aid response that actually fits what's happening in front of you. They'll also notice how you speak to the casualty and people around you, how respectfully you act, and whether you use PPE, the first aid kit, and the AED accurately and with purpose. Feeling nervous is completely normal. Take one slow breath, keep your pace deliberate, and you'll give yourself the space to follow each step without skipping ahead. As you work, say exactly what you're doing out loud. I'm checking for danger, calling for help, opening the airway, and monitoring breathing. If your mind suddenly goes blank, saying a simple checkpoint out loud shows your assessor where you are, and it can help you find your place again. Come dressed and ready to work in the space you're given, because you'll need to kneel down, move around the casualty, and handle the equipment comfortably as if the situation were real. Once you begin, keep your attention on the casualty, the order of your actions, and the equipment you'll need next, so each move flows calmly into the one after it. For adult CPR, you may need to keep compressions and breaths going for at least 2 uninterrupted minutes on a floor-level mannequin, then follow the AED prompts exactly as they come. You'll also be assessed on recovery position, choking, bleeding control, shock care, and other scenarios the way they'd happen in a real workplace response. And with infant CPR, the technique changes. Use a firm surface, give 2-finger compressions, and match your rescue breaths to an infant's smaller anatomy. So now, rehearse it the way you'll actually do it. Run the sequence, say every action out loud, and practice linking each step smoothly so you don't stall between decisions. And make sure your assessment resources are familiar before the day starts, so when you need the first aid kit, PPE, or AED, your hands go straight there without a pause. When the moment comes, you don't need to be perfect. You need to stay calm, follow the sequence you've practiced, and show each action clearly and respectfully. That's how you show what this assessment is really for. Not catching you out, but confirming you're ready to respond safely, one step at a time.